So I'm here today to talk to you about a low-carb program that we launched just over a year ago, and we've had over 185,000 people go through it. So just before I start talking to you about the program, I just wanted to give you a bit of background on diabetes.co.uk. It's not Diabetes UK because that's the UK Association for Diabetes, and we're a separate organisation to them. We're the world's largest and most engaged patient community and health management platform. Each month we have over 2.5 million visitors and a registered database of over 525,000 members. We run and host the world's most active and online engaged social platform. It's a forum, like Dr. David Unwin mentioned, and it's basically a community of people and patients that have diabetes or have an association to diabetes, whatever type that may be, where they can talk to each other, get advice and support, and help learn and kind of grow and develop from them. We also run the world's most engaged diabetes Facebook community, and we have over 325,000 members. Over the last 4 years, we've been collecting data from patient feedback, from surveys, and also sentiment analysis on the forum, and combining this with the latest evidence base to create digital health interventions. So the current situation for type 2 diabetes in the UK, at least, is that people are recommended that they should be following a calorie-restricted, low-fat diet, and they're told to increase the amount of exercise that they're doing. But actually, on the basis that they only spend around 3 hours with their healthcare professional each year, and that leaves over 8,757 hours where they're managing their diabetes all on their own. And that's kind of where we come in as a platform. On top of that, around 3% of people with diabetes get access to structured education offline, and that's obviously there's many issues with that. Mainly the fact that people need to turn up to a clinic to learn what they should and shouldn't be doing, and kind of on top of that, they're being told the wrong advice in many cases. So yeah, that's where we come in. The global burden of diabetes in the world is £400 billion each year, which is $500 billion. And this is an absolute tragedy on the basis that type 2 diabetes, pre-diabetes, and many of these other kind of comorbidities are largely preventable. So like Dr. Unwin mentioned earlier, type 2 diabetes used to be known as sugar diabetes, and that's with the assumption that it is sugar that is people have an intolerance to sugar, and that's what's causing the problems. And if it's kind of left unattended and unmonitored over the course of time, it can lead to long-term complications such as retinopathy, heart disease, and stroke. So Sam mentioned earlier the public health collaboration of referenced randomized control trials. So there's 28 randomized control trials that have directly compared a low-calorie, low-fat approach to a low-carbohydrate approach to managing type 2 diabetes, pre-diabetes, and obesity. In general, the low-carbohydrate groups, as I'm sure you're aware, lose more weight, they improve their cholesterol, they reduce their blood pressure, and they reduce their HbA1c. Over and above that, the dropout rate for people in the low-carbohydrate approach is much, much lower, which kind of indicates to us that if it was down to patient choice rather than public health guidelines, people are much more likely to be able to sustain a low-carbohydrate approach to managing their diabetes compared to a low-calorie, low-fat. So contrary to what we've been led to believe, blood glucose normalization can occur, and it's all off the basis that you follow a kind of a reduced sugar and low-carbohydrate diet. For people with type 2 diabetes, that means that it's not a chronic progressive disease. You're not destined to kind of have all of these horrible complications. For someone with pre-diabetes, the diagnosis of pre-diabetes doesn't automatically mean that if you carry on the same route, obviously it would lead to type 2, but actually there's something that you can do about it. And for type 1 diabetes, which has had a little bit of a mention today, blood glucose normalization can occur if you do reduce the carbohydrates and the sugar intake that you're eating. And that means that you're able to kind of improve your management and reduce your long-term complications. So like Dr. David Unwin mentioned as well, here he is. And I have apologized for him being a troll, by the way, numerous times. And he was let back on quite quickly as well. So People have been talking about a low-carbohydrate approach to managing their diabetes on the diabetes.co.uk forum for over a decade. People have been sharing information, they've been sharing goals, sharing advice, and and support as well. So with the expertise of Dr. Unwin and the feedback from 20,000 people on the low-carbohydrate forum, we've put together the low-carbohydrate program. The Low Carb program is the world's first structured education program aimed primarily at people with type 2 diabetes. It follows a 10-week structure that basically encourages people to improve their blood glucose control and help them lose weight in a maintainable way if that's what they need to do. Each week, people are given a different element of their diet, and over the course of 10 weeks, they're given small, sustainable action steps that go along with that particular element of their diet. So the question's over, okay, so I understand a low-carbohydrate approach is a good one for me, but what does that actually mean in terms of what I should be eating and what shouldn't I be eating? So over the course of the 10 weeks, we cover things like alcohol, takeaways, eating out with on a low-carb diet, and then also the action points are kind of really small things that they make each week that then over the course of the 10 weeks and beyond really equate to quite a big, significant improvement in their health. Throughout the program, we're encouraging people to track data. So we're encouraging them to track their HbA1c, mood, which is quite an interesting thing, especially for people because they haven't necessarily made the association between their mood and the food that they're eating and the choices. We're getting people to track their nutritional intake, their sleep, weight, obviously blood glucose levels if they have access to that. But one of the things that we're encouraging them to do is measure their waist to hip ratios. If it's basically a way that people can use any of these different things to track their own data, and that's then used as positive reinforcement to see that those small changes that they are making is having quite a significant impact. One of the last ones that we also track is selfies. So quite often people don't want to weigh themselves straight away, or they kind of don't want to, or they can't necessarily see the change in themselves. So we encourage them to take selfies and kind of see their before and afters over time. All of our program is completely supported by a community of people. So they're socially engaged individuals who are all on the same journey towards that low-carb lifestyle. It's not kind of a fad diet that people are following for a couple of weeks and then kind of reverting back. There's a community of people that they're doing it with that help them to kind of like, push them through and kind of go on. And each week there's given, there's an array of resources like cookbooks and meal plans and things like that. So the message of the Low Carb program is really simple. We're looking at the overall sugar burden that comes from natural sources such as honey and fruit, added sources such as cereals and biscuits, and then the product of digestion such as when people eat complex carbohydrates like pasta and bread. And what occurs as the eureka moment for quite a lot of people when they join the program, and based on the graphs that Dr. Unwin was just showing us, we show people 2 common breakfasts that they may want to have. So option A is kind of bran flakes and skimmed milk, whole grains and fruit juice, and option B is a 3-egg omelette with cheese and butter and mushrooms and a full-fat coffee. So everyone comes on and they say, oh, well, you know, I'm eating low-fat dairy and I'm eating my whole grains and I've got my 5 a day covered because I'm drinking fruit juice in the mornings. But when we put that in terms of the amount of sugar that they're eating, and we actually show them in terms of the teaspoons of sugar, it's 16 teaspoons for the first option and less than 1 for the second. So kind of speaks for themselves on quite a lot. The outcome that we're looking at primarily is HbA1c. So as Dr. Unwin said, it's the 90-day average blood glucose reading. And a reduction in just 1% in your HbA1c, which is 11 millimoles per mole, equates to a reduced risk of amputation by 43%, a reduced risk of cataracts by 16%, and a reduced risk of heart failure by 19%. So we've assessed the low-carb program at a year, which actually includes Christmas. So it's kind of like the results are slightly improved as based on the results that we're looking at the moment. So at 365 days, We had over 160,000 members. 80% of the people that go onto the program actually go on to complete it, either in part or in full. And that kind of covers things like if, for example, people don't watch the first one where we're talking about fizzy drinks and reducing the added sugar that they're eating. So quite a few people come onto the program having been on the forum already or found information from other sources, and they then go on to complete it. 80% of the members who complete the program lose weight, and the average weight loss stands around 7.5 kilos. The average HbA1c reduction is 10.8 millimoles per mole, which is just less than that 1% that we were aiming for. Interestingly enough, 1 in 3 people come off all of their diabetes-related medications as a result of being on the program. And we're in the process of publishing these results in a clinical paper. So the combined weight loss of all of the people that are on the program so far stands at 1.8 million kilos, which incidentally is equivalent to 5 jumbo jets and 667 elephants, in case you wondered. On top of that, we've looked at a sample of 7,297 people, and we're looking at the medication that they were on at the start of the program and then at the end. And through medication deprescription of diabetes medication alone, the cost saving to the National Health Service in the UK stands at around £6.9 million. Thank you. So I can talk about lots of data and lots of outcomes and things like that, but what really brings the program to life is the thousands and thousands of anecdotes and real-life testimonials of people who have gone through the program and have found that it is of benefit to them. So Bob, the guy in the top left-hand corner, he's lost 16 kilos, and his HbA1c has reduced from 53 millimoles per mole to I think it's 41 millimoles per mole. On top of that, he had a detached retina, which he got fixed, and then developed diabetic what's it called? That's the one. You can tell I'm not a doctor. I'm not. So that's the build-up of fluid on the eye, and he went to his optometrist, and they asked him if, obviously that it's normally treated with steroids and injections and things like that, but he said that he wanted the opportunity to reduce his blood sugar levels, which were kind of out of control at that point. So joined the program, and I think it was 14 weeks later, he didn't have to have any treatment, and his eyesight was much, much better. Also, on top of that, I just wanted to draw your attention to Sarah in the bottom right. She has type 1 diabetes, and when I met her, she had a go at me because we'd only referenced type 2, which is obviously the original aim of the program. We've now found that there's been a huge amount of people with type 1 diabetes who have gone through the program. She's lost 4 stone and is on a quarter of the amount of insulin that she was on before she started low carbing. And what's really significant with her and many of the other type 1 anecdotes that we hear, their symptoms of hypos and hypoglycemia is much, much better. So they're able to avoid kind of dropping out of that good goal zone that they're trying to aim for. So based on the feedback from the first 100,000 people on the low carb program, we've relaunched on the 30th of January this year, version 2. As you can see, it's now in a native app. So we have iOS pending and Android available in the Play Store. As you can see, the most important aspect of the app is the education, and that's the first and foremost objective of people joining the program. It's to educate them and let them know what we're doing. But what we've done is integrated a lot more the tracking, so we found that we've got over 4 times the amount of data that's being tracked as in version 1 of the program. And we're now supporting the development and maintenance of the low-carb lifestyle the journey that people are on, with a lifestyle section of the program, and that's providing information and further education and kind of drawing people back into the program to keep them on that journey. So what makes the low-carb program so successful? What is it about the low-carb program that is having this effect? Well, first of all, it's disease-specific. So like I said, it's primarily aimed at people with type 2 diabetes. A lot of the information on the program is about type 2 and how reducing your carbohydrates can impact your blood sugar levels. Secondly, it's structured and grounded in health psychology. So we've worked with Jen, Dr. Schroman's lovely wife, and to make sure that it's solution focused and goal focused. So one of the things we get people to do when they first sign up to the program is set their own goal. It's not about asking them what their healthcare professional would like them to achieve, it's asking them what they would like to achieve. And actually we thought originally perhaps it would be weight loss or something like that, but what people are more likely to select in those options are is the fact that they want to come off their medication or avoid medication altogether. We're collecting rapid, real-time data, so people are able to have that positive reinforcement of seeing their data. They can move seamlessly from their mobile phone app that they're tracking their data on their day-to-day basis, and then when they come back onto their PC, that same data set is there that they're able to use and engage with. Obviously, the most important thing about the program is the fact that it's integrated and supported by a whole network of people. So the testimonials that I've just shown you are champions on the program. So they are helping other people, they kind of pick people up when they fall off the bandwagon, they answer questions, they provide support. And so it's a kind of a patient initiative run by patients for the patients. There's a lifetime engagement and support network that we provide, so people's readiness and confidence to make significant behaviour changes really changes over time and is completely unique. So one of the things that we find is that people maybe want to sign up and have a look around the programme, but they're not quite ready to make those changes that we're suggesting. So what we use is our push notifications and email notifications to draw people back in and say, hey, you came in and you were using this tracking tool, why don't you come back in, and then nudge them through to different parts of the programme that they may then find useful. And lastly, what we're finding is that we're able to motivate a previously disengaged and disempowered community. So people with type 2 diabetes, they don't know that although they know that they need to lose weight and they know that they need to increase their exercise. The program purely focuses on nutrition, but it doesn't mention anything about reducing your stress or increasing your sleep and things like that. But just through tracking that, we found that people are actually improving their sleep. They're sleeping for longer, they're improving their mood, and they're increasing their exercise as well, which is quite significant because I think there's a lot of research recently that are saying that people with type 2 diabetes or people that are obese really struggle to get into exercise. So by addressing the nutrition first and using that as the first thing that we're looking at, people then feel motivated, they're increasing their energy, and then they're actually exercising more as well. So the Low Carb program has had some global press, including featuring on the front cover of the Times and the Daily Mail in the UK, and also featured in Dr. David Unwin's article in the New Scientist that was published last June. And all of the work that we've done culminated in diabetes.co.uk winning the National Business Award for Positive Social Impact. The judges made particular note of the fact that we were not only saving NHS budget, but we were saving lives as well. There's 417 million people with diabetes in the world, and there are 374 million with type 2 diabetes, and they are who we're targeting. We're not restricting ourselves just to the UK at the moment. Of the 180,000 people who have joined the programme, they've come from 219 different countries. But we understand that the way that we will make the outcomes more effective in each of these other countries is if we localise it in terms of the cuisines and the things that are actually being eaten in those countries. And that's what we're aiming to do over the next couple of years. In terms of the velocity and the variety of feedback that we're getting from the programme and from the feedback that we're getting from the users, we're able to be continually enhancing the programme and making changes so that we can improve those health outcomes. So next week we're going to be integrating some intermittent fasting modules, which will be bonus modules that people can use once they found perhaps that their weight loss has plateaued on the programme, or people who are more likely to be eating kind of starchy carbohydrates as their cultural norms and the foods that they would be eating. We're also putting a focus on mental health. So official statistics suggest that 9% of people with diabetes have depression, and 15% of people with diabetes have disordered eating of some description. On the data that we've collected so far, this looks at a much higher rate of around 30 to 35% of people that have joined the Low Carb program have said that they've been diagnosed with a mental health condition by a healthcare professional. So we've seen that this is a really important thing that we need to address concurrently with the nutrition. So we're working with a team at the University of Amsterdam to put together a bespoke module that will kind of nudge people through if they've said that they've got that health condition, and then they can also support the journey through the Low Carb program as well. Based on the feedback, we want some human coaching. So we're looking at integrating some human coaching from clinics and people that are already doing this sort of things to give that extra support for people who feel that they need the support from a healthcare professional on a one-to-one or group basis. Obviously, I've spoken about the translation and localization, but what we're also looking to do is put together a bespoke pre-diabetes and type 1 program together. So again, we're focusing on that health-specific, disease-specific approach, and we're looking to put something together that's bespoke for that group. One of the criticisms of the low-carb research is that there's a lack of longitudinal evidence. So one of the things that we're looking to do with the data is provide that long-term database and evidence base so that kind of people, when they come to you and say, well, you know, what's all the evidence? We've got something that's a lot more long-term and big data. You know, the N numbers that we're looking at in some of the randomized control trials look to be around 65 to 100 maximum. But we're looking at thousands and thousands of people who are submitting their data. And finally, we're looking to integrate with the genome. So diabetes.co.uk as a whole have an openness philosophy rather than a privacy policy. And on that basis, we've got thousands of people who have already told us that they would be willing to donate their genetic markups, in which case we're able to actually integrate the genome with the digital health intervention that we're providing. So we're looking at creating the most bespoke and precise medicine and healthcare platform for all people with diabetes. And that's it. Thank you.